Hi, my name is Fernanda Rivadeneira. I am going to talking about cortisol, physical activity, and weight loss in a randomized clinical trial. Definition: also known as stress hormone, which is produced in the adrenal gland and serves to increase the level of sugar in the blood. One of the functions of cortisol is suppress the immune system, assist macronutrient metabolism, and control water and electrolyte homeostasis. This hormone is produced in stressful situations or in response to a decrease in the concentrations of glucocorticoids in the blood.
Hi, I'm Dr. Zandra Palma. I'm a physician here at Parsley Health in New York City, and today I'm going to explain to you a little bit about what cortisol is. Cortisol is something I measure a lot in my patients, especially anybody with chronic fatigue, depression, anxiety, and inflammation, obesity. And the reason I do that is because it can contribute to a lot of those pathologies. So cortisol is a stress hormone. It's excreted by our adrenal glands, these two little glands that sit on the top of the kidneys, in response to stress. In our normal adaptive environment, we evolved to secrete cortisol when an acute stressor happens. So let's say a Paleolithic man's being chased by a lion. He's supposed to secrete cortisol, and this set of metabolic and sympathetic responses is supposed to start. What's not supposed to happen is we're not supposed to have many little stresses throughout the day and keep excreting cortisol and keep excreting cortisol. Let's say non-Paleolithic man, but man that's riding the subway, spills coffee on his shirt, then is late to work, then his boss is upset, then he has to do a meeting. That's many episodes where he's excreting cortisol. Sometimes people's cortisol, because of our modern stressors and our modern lifestyle, can be either too high or too low. You can excrete so much over the long term that your body just says, I don't need to do this anymore, or it can be chronically elevated from inflammation or other states. So let's talk about what cortisol, when it's out of sync, does to your body. I'm going to say the first thing that you'll pay attention to: cortisol makes you fat. Cortisol specifically deposits fat in the abdomen, so belly fat. If you've got a lot of stubborn belly fat, you might want to be tested for cortisol just for that. Cortisol is a class of hormones called glucocorticoids. So it's right in the name, gluco. It interacts with glucose and the glucose system. So it can derail how your body deals with storing sugar, letting sugar free, and the insulin and glucagon system in the pancreas. Cortisol is also a great anti-inflammatory, so we need a certain amount of cortisol. So if your cortisol is too low, you could have chronic inflammation. You could have depression or anxiety. You could also get that from high cortisol states. Cortisol also interacts with other hormones. So cortisol can attack the sex hormones. It can, if it's too high, make your testosterone too low, or your estrogen and progesterone, causing dysregulation in male and female health. Cortisol can also dysregulate the thyroid. The thyroid is the metabolic master of the body. So when cortisol dysregulates the thyroid, all parts of cellular metabolism can get out of whack. If you want to read more about this, there's a great book that's full of primary literature resources and references. It's called Why Zebras Don't Get Ulcers by Robert Sapolsky, and it's talking exactly about that evolutionary difference between how we evolved and how our cortisol system evolved, and how we live now and how the cortisol system can get dysregulated. I read this book in college in my endocrinology class, and it's still relevant today. We'd love to have you here as a member at Parsley, where we can do that kind of testing and address the underlying root cause of some of these issues that I mentioned, because this is not done in conventional medicine, and we think it's really important to explore this system, how it interacts with other endocrine systems, and how it interacts with other body.
Applications in nutrition. A control in the habits and hygienic health conditions can help us to reinforce the immune system, which protects us from bacteria, viruses, and other pathogenic organisms. It is also important to note that exercise reduces cortisol levels, Moving regularly and staying in training these days increases the production of serotonin and dopamine, which prevent anxiety and depression.
Hi, I'm Charlotte Lawson, a registered and licensed dietitian here in Tampa Bay, Florida. And you may have some questions on how you can eat to help promote a good cortisol level in your body. Where cortisol is like a stress hormone in our body, so not only what we eat, but our lifestyle really can affect these levels. Make sure that you're trying to avoid added stressors in your life. Make sure you're getting enough fluids and enough appropriate sleep. Also try to avoid things high in caffeine and high in additives, especially like those simple added carbohydrates. They tend to spike our insulin and digestive process a little bit quicker and therefore can just add to that cortisol level as our body has to deal with that extra stressor of digestion. Now, trying things in our more complex form, like your fruits and vegetables and the whole grains, these are really recommended, along with that added fiber. The more things we can eat in our whole form, the more our body has to take time to digest, and it's a slower, more calming process. Again, not just with diet, but lifestyle. Overall, maintaining a healthy weight has improved cortisol levels as well. So if you need to lose a little bit of weight, aim for a negative calorie balance, meaning you consume less calories than your body works off or burns off. And this can be a combination of reducing calorie intake or increasing exercise. It has been also proven that to help reduce stress in general, regular physical activity on an everyday basis is really optimal. And if you can aim for 30 to 60 minutes, I know it sounds like a lot, that's really going to show you that benefit. So appropriate weight, getting good sleep, staying up on those fluids, trying to maybe avoid the simple carbohydrates along with that caffeine, and again, good exercise per day. Hopefully, with those couple tips, you can keep yourself at a good cortisol level. I'm Charlotte, and eat happy.
Pros and cons. Pros are response to stress, fight infections, regulate blood sugar level, maintain blood pressure, regulate metabolism, the process by which the body uses food and energy. Cons are indigestion, irritation, and inflammation of the intestinal mucus occur, which could lead to ulcers, increased blood pressure, chronic heart disease, heart attacks, weight gain, diabetes, and osteoporosis. Issue applied in Ecuador. It was demonstrated in a randomized study that medical students at the Central University of Ecuador are under constant stress, and this affects their health and therefore their academic performance. It is difficult to diagnose stress, but there are a number of indicators to determine what level of stress a person is at: cognitive, physiological, and motor level. Conclusion. The search for food and its consumption represent behaviors aimed at obtaining the energetic substrates necessary for the maintenance of the different organic functions that an individual requires to guarantee its survival. Remember that in situations of intense physical exercise or prolonged aerobic exercise, a situation of stress is generated in the body, releasing cortisol in proportion to the intensity, in order to increase glucogenesis and maintain blood glucose. Thank you.